Welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Rate and review the show at kevinmd.com/rate. Subscribe at kevinmd.com/follow. Today's show we have Beth Quaas. She is a nurse anesthetist and she co-wrote the Kevin MD article, A Tale of Two Nurses. Beth, welcome to the show.
Thanks so much for having me on, Kevin. I'm happy to be here.
We'll get into your article in a little bit, but first off, can you share your story and journey to where you are today?
Yeah, I've been in nursing for almost 30 years. The last 22 years have been in anesthesia. I've worked as a CRNA since 2000. Most of my clinical time has been between a large hospital moving into same-day surgery. And then about a year and a half ago, I moved into education. So now I'm teaching new student nurse anesthetists.
So tell me about some of the rewards and challenges of being a nurse anesthetist today.
I feel like I am in control of that patient's care during one of the most vulnerable times in their lives when they're having surgery. And that comes along with trust, developing rapport with patients, and being that patient's sole advocate for that time while they're under anesthesia.
And tell me about what you feel are some of the challenges of the profession going forward.
I think challenges, we're getting busier, we're getting sicker patients, we're under a lot of production pressure. And so I think that really creates a time when we need to remember we're there for one patient at a time. We can't be worrying about speeding up the process to make more money. We really have to just focus on one patient at a time.
Now, for those who are interested in pursuing their education and potentially become nurse anesthetists, what kind of characteristics or traits should these people have?
In order to get into school itself is very competitive. You have to have really good natural science grades, a good understanding of the sciences. Of course, ICU experience is going to be paramount, getting into a very busy ICU, taking care of the sickest of the sick patients. And then when you're in school, really time management and focusing on, developing those skills, those analytical skills that you need. Graduate school is completely different than undergraduate. And so learning how to take responsibility for your own study is what's going to get you through. It's a great profession. We're doing so much more now than we were when I started that it's a great time to go into anesthesia.
What's your relationship of nurse anesthetists with the physician anesthesiologist?
The facility that I've worked in, I work in an anesthesia care team model. And so we work closely with our anesthesiologist colleagues. It's a great relationship where I work. It's great to have a second pair of hands, someone to bounce ideas off of. And then we have CRNAs that are working out in solo practice that also have to be on the top of their game. So we do a lot of different things in anesthesia, and you can certainly move around and find what you love to do the best.
All right, let's transition to your Kevin MD article. It's titled A Tale of Two Nurses. You co-wrote it with June Guerin, who also is a prior Kevin MD guest. But for those who didn't get a chance to read your article, can you just walk my audience through it and share the story of why you and June decided to write it?
I had been in management for a while. I decided to step back into my clinical practice, and then the pandemic hit, and I was feeling burnt out. I think seeing the administrative side of healthcare was disappointing to me in some ways. I think in that role, we've taken away from patient focus. And so long story short, I think I was feeling burnt out in the clinical world. And so I decided to start a podcast because there were so many other nurses that were feeling the same way and the frustration, and we just wanted to take good care of patients. So I wanted to have a platform for nurses to tell their stories as well, for recognition for what they do, to inspire other nurses. And so that's how I met June Guerin. She was a guest on my podcast. She had been assaulted by a patient, and so she's a big advocate for safety in work environments and safety for healthcare providers. So that's how I met June. And we kind of came at it from two totally different worlds, but we decided that our main goal was to work to improve work environments, safe environments, and just a place for nurses to feel like they still want to remain in healthcare.
So tell me some of the stories that you've shared on your podcast or stories that you've heard that really illustrate some of the difficulties nurses have that potentially may lead to their burnout?
Well, they are so many, but they are shared by so many. Of course, COVID problems existed long before anyone had heard of COVID.
Hmm.
Staffing ratios, patients, nurses having to take on more patients than they felt safe. And I've been in that world, although it's many years ago that I've done bedside nursing. Even back then, we have better outcomes for our patients when we can spend more time with them. And us as healthcare providers and healing people, we know that if we can spend more time with them, the outcomes are better.
Hmm.
So I think staffing ratios are one thing. The hard physical work, I don't know if people realize how physically demanding nursing is on patients. The long hours, no bathroom breaks, no time to eat. And so we don't have the self care. And this isn't specific to nurses. This is all healthcare providers, physicians, nurses, respiratory therapists, nursing aides. And so I believe that we all have the same challenges.
Hmm.
We just need to come together and find out, how do we move forward to improve that?
You talk specifically about the physical challenges that people may not be aware of. Give us an example of some of those challenges.
Well, we know that obesity in our country is becoming more prevalent. Those patients, when they're in the hospital, need to be moved. They need to be turned. That's physically demanding. Some of the larger hospitals have teams dedicated to positioning patients. They're not always available. That is not available in, I would say, most of the facilities that we have. Being on your feet for 12-hour shifts or 16-hour shifts, um, on those hard concrete floors. Of course, we may not be in the best physical shape as well. And so all of those things come into play when we are really working and damaging our bodies in those areas.
Now, there's the proverbial great resignation where a lot of healthcare professionals are simply getting burnt out and leaving the profession. Tell us about the steps going forward. Do you think that's permanently harmed the nursing profession? Because as more people leave, that's going to increase the stress on the people who are already staying. So tell us about some of those repercussions in the next, say, year or so.
Yeah, I think I can see both sides. I think for those that have just had enough and they're burnt out for their self-care, they need to walk away. For the people left doing it, the demand on them is going to be greater. But I think that we came to this point not just because of COVID, as I mentioned, this has been building for a long time. How do we get through that? That's what I'm interested in. What do we really need to change to keep people from leaving healthcare? And I think now is the time to make that. So, is the great resignation here? I believe it is. Is it all bad? No. And especially for those people that really need to leave for their own health.
So tell us about some of your solutions. How can we mitigate and solve some of these problems that you bring up?
I think right now it's starting. I think people are starting to talk. We need communication. We need to find out what the main problems are and how do they affect patient outcomes. I believe that we can't just complain. We can't just talk about these things and not find solutions. So the solutions are going to be harder to come by, but now that we're all coming together and defining the problems, I think that's going to help us move forward with solutions. And I think starting out with more people to take care of patients, whether it be nurses, nurses aides, RNs, LPNs, more physicians, more respiratory, we need all of those services to come together and decide, how do we move forward to create the best working environment and the best outcomes for our patients.
What kind of advice do you have for nurses who are at the bedside, who may be listening to you on this podcast and perhaps on the cusp of burning out and debating whether to stay at their job or leaving altogether? What kind of advice do you have for these nurses?
Do not stay in a toxic environment. It is very difficult to change culture. As we know, it takes a long time. And I think that has to start with administration, not allowing certain toxic behaviors. But I would say burnout comes from staying in those toxic environments.
Mm.
So If you need to leave, please find somewhere else. Try that before just walking away from nursing. It takes a lot to be a nurse, and we're losing some really good, experienced people because of that. So my advice would be, please seek out another place to be before just leaving healthcare altogether.
And to those healthcare administrators, and I have many of those who listen to this podcast, what kind of message do you have for them to improve the working conditions for nurses?
Listen to your nurses. Go to their areas, follow them. Follow them for not just an hour, follow them for a shift or a day or a weekend. Come in and see what the challenges are. Sometimes just simple changes can make a world of difference in that nurse's work environment, that shift for them.
So, what kind of simple changes would you recommend, or what kind of examples of simple changes could these healthcare administrators make?
I would say first, make sure they have the supplies they need readily at hand.
Mhm.
Don't have them run or wait for things that they need right now. Number two, supplement the caregivers. Get more nursing aides on the floors that can do some of that work so that the nurses can focus on the real nursing at hand.
We're talking to Beth Quaas. She is a nurse anesthetist. She co-wrote the Kevin MD article, "A Tale of Two Nurses." Beth, what are some of your take-home messages that you want to leave with the Kevin MD audience?
I want us to come together as a community, as a healthcare community, and define those problems. Really, everyone has a solution in them. Talk about what isn't working, don't complain, and then let's start moving forward to solutions to help ourselves, to help our patients, so that we can really improve where all of healthcare is going.
And if a nurse wanted to share his or her story and perhaps bring to light some of these issues, what are some ways that nurses can make their voices heard?
Well, I have a podcast called Don't Eat Your Young, and I would love to talk to anyone that wants to share their story. You can find out how to do that on my website, don'teatyouryoung.com. I think finding like-minded people in your facilities that you work in, form a committee and start talking about what problems do you face maybe just on your unit. And then within your facility itself, start small to make small changes that will make a big impact later.
Beth, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks, Kevin. I appreciate it.